out why Sinai-Grace is looking for the best hamburger on the block. Next on Sinai-Grace Today. Hello, I'm Melanie Moss. Think you have the best burger on the block? Put your recipe to the test in the cafeteria's signature burger contest. The goal of the contest is to find Sinai-Grace's favorite hamburger. A box will be in the cafeteria for employees to submit their best burger recipe, and a panel of judges will determine the winning burger. The winning burger will become Sinai-Grace's signature burger with a permanent spot on the cafeteria's menu. Employee submissions will be accepted now through July the 23rd. For more information, call 64622. Our recent hazmat exercise was a big success. The purpose of the exercise was for Sinai-Grace employees to practice caring for victims who have been exposed to toxic materials. Volunteers portrayed victims, family members, and news reporters during the drill. A big thank you to all the volunteers who donated their time. We couldn't have done it without you. Did you know that there's a robot helping surgeons in the OR? Let's go to Catherine Higgins with more of the story. Catherine?
Thanks, Melanie. At Sinai-Grace, we've recently got some new advanced surgical technology, the Da Vinci robot. Here to tell us more is Dr. George Shade. Dr. Shade, tell me about the Da Vinci and what all it can do.
The Da Vinci is the latest development of robotic surgery, which allows several disciplines: gynecology, general surgery, neurosurgery, cardiothoracic surgeons, and even ear, nose, and throat or otolaryngology surgeons to do minimally invasive surgery with precision and clarity that you could not do otherwise. Has a 10-power magnification that gives you detailed views of the anatomy. It has 3D, so it's as if you were working with the particular part of the body open and you're standing there working in a regular mode. But it's minimally invasive, which means very few small incisions, less bleeding, and the patient is usually home the next morning with significantly less pain, faster recovery.
Great. So what are some of the benefits for patients with this new surgery?
One of the benefits, obviously, is if you can do a major surgical procedure through 2 8-millimeter incisions and 1 small 10-millimeter incision for a laparoscope, and send them home the very next morning for operation that would normally require hospitalization for 3 days up to a week, and then 8 to 10 weeks recovery time, and they're basically functional again in 2 weeks, but going home with very little discomfort.
And Dr. Shade, what types of surgeries will we be performing with the Da Vinci?
In the Department of Gynecology, we're going to do pretty much the whole gamut. We'll do total hysterectomies, we will do supracervical hysterectomies. Our oncology division will be doing major cancer surgery and radical surgeries using the Da Vinci with less bleeding, less pain, and again, faster recovery, better precision in terms of doing node dissections in cancer patients. Our infertility division will be doing a lot of reconstructive surgery in the pelvis for infertility cases. And for benign gynecology, we'll be treating everything that we would normally do with an open incision or with the regular laparoscope. We can do it with the robotic system.
Great. Thanks, Dr. Shade. Sinai-Grace, we're advancing surgical technologies here with the new Da Vinci robot. I'm Catherine Higgins for Sinai-Grace Today.
When reaching for objects, it's important to remember these 3 tips. Keep your back straight, use both hands, and face the object you are reaching for. Remembering these 3 tips can help keep back strain out of your reach. I'm Julie Frascarelli, and that's my tip of the week.
Hello, my friends. Conrad here. Let me talk to you a little bit about the Vanguard transaction. You know that we've already gotten approval from the Detroit City Council and from the Wayne County Commission for our DMC Renaissance Zone. That zone will allow Vanguard to put into the DMC and the City of Detroit $850 million in new capital improvements on this campus and the downtown campus, as well as Huron Valley. So believe me, change is in the air. And although we strongly believe this deal will be of huge benefit to the entire DMC, we cannot rely on Vanguard to come in and fix all of our problems. We need to begin examining what our issues are right in our marketplace today. For instance, we know that patient volume in the market area that we're in has remained flat, and yet our numbers at the DMC are for some reason decreasing. Now, why is that? If any one of you has an idea why, please let me know. I'm interested in hearing all of your feedback. We need to have patients come to the DMC when they need more than just emergency care. All of us are very pleased, in fact, to know that we have the largest market share for ER visits. In fact, Sinai-Grace is going to do 95,000 ER visits this year alone. But sometimes these same patients are not returning when they need other medical services. And you and I have to figure out why that is the case. This, my friends, simply has to change. We all need to remain customer service driven no matter what. We all need to take responsibility for increasing our volume and ultimately our market share. We know the future of Sinai-Grace is in our hands, and we also know that new infrastructure is not going to magically solve all of our problems. The only thing that's going to resolve this issue is continuing excellent customer service. There is another thing as well that we need to be focused on, and that is the necessity to improve all of our processes here in the hospital. Some things we simply have to do better. Some things have to be better organized. For instance, the whole patient scheduling process has to be revamped. Mrs. Jones ought to be able to call one number and schedule all of her tests. That's not true today. Mrs. Jones ought to be able to go to her physician office in anticipation of surgery and have someone else, not her, be responsible for making sure that all of the insurance notifications have occurred on a timely basis. It's not her job today. It is the job of the physician's office. Maybe there's something about that we can change. Across the board, we need to examine everything that we are doing with an eye toward being better. That's the responsibility. That's the requirement. When Vanguard closes, and it will, all of us will need only do a few simple things to make sure that this transaction is a success. And all of that requires is your best every day. Thank you.
Tune in next week for the latest news affecting you. To watch this episode and more, visit Sinai-Grace's YouTube channel and Facebook page. I'm Melanie Moss. Thanks for watching.